Ethiopia faces a growing crisis in its healthcare and education systems. Hospitals are struggling, doctors are refusing to work, schools are closing, teachers are protesting in the streets. The heart of the problem? The government is not paying many doctors and teachers their salaries. People are suffering because they can't get the basic services they need. In rural areas, the situation is even more dire. Hospitals are chronically understaffed and under-equipped. With doctors on strike, patients are left stranded. Some must travel for days to find medical help. The situation is a matter of life and death for many. The education system is equally crippled. Teachers, who dedicate their lives to shaping young minds, are struggling to make ends meet. They are forced to choose between feeding their families and educating their students. The classroom, once a place of learning and growth, is now a stage for silent protest. The root cause of this crisis is clear: a lack of respect and support for the very people entrusted with the nation's health and future. Until this fundamental issue is addressed, the crisis will only deepen. For months, doctors across Ethiopia have been demanding their unpaid salaries. They say they cannot survive on promises and empty words. Some doctors report going without pay for over a year. They are struggling to afford basic necessities like food and rent. The government's response has been inadequate at best. Officials blame budget shortfalls and economic challenges. However, many doctors believe the government is simply not prioritizing their well-being. This perceived disregard has fueled anger and frustration within the medical community. Adding insult to injury, the government has resorted to intimidation tactics. Doctors who speak out or participate in protests risk being arrested or detained. This heavy-handed approach has created a climate of fear and silenced many who would otherwise join the movement. The doctors' demands are simple: pay their earned salaries and treat them with the respect they deserve. Until then, the healthcare system will continue to crumble, and the people of Ethiopia will bear the brunt of this crisis. Teachers in Ethiopia are facing similar challenges. For months, they have endured delayed salary payments and broken promises. Like their counterparts in healthcare, they are struggling to make ends meet. In Hadia Zone, teachers took to the streets to protest salary delays. Their calls for justice were met with a harsh response. The government closed schools, affecting over 100,000 students. In another incident, over 20 teachers were arrested in Kelemwalaga zone for refusing mandatory salary deductions. These incidents highlight the government's heavy-handed approach to dissent. Instead of addressing the legitimate grievances of teachers, they resort to intimidation and silence. This approach is not only unjust, but it is also counterproductive. It further erodes trust in the government and exacerbates the crisis. The teachers' message is clear. They are essential workers who deserve fair compensation and respect. Their fight is not just about salaries, it is about the future of Ethiopia. The ongoing protests by doctors and teachers are part of a larger movement in Ethiopia known as the White Revolution. The term refers to the white coats worn by medical professionals, a symbol of their profession and their commitment to serving others. The White Revolution represents a peaceful call for change. It is a demand for better working conditions, fair compensation, and a government that listens to the needs of its people. It is a rejection of intimidation tactics and a call for dialogue and respect. However, the government's response has been anything but respectful. Instead of addressing the concerns of these essential workers, they have resorted to arrests and intimidation. This approach will only deepen the crisis and further erode trust in the government. The message of the White Revolution is clear. Ethiopia's future depends on a healthy and educated population. The government must prioritize the well-being of its citizens and invest in the very people entrusted with their care and education. Until then, the fight for a brighter future continues. If you found this video helpful, please subscribe and like for more updates.